Hello, Mrs. Lee. My name is Walter Matheny. I'm going to be doing a focused assessment on you today of your thorax and lungs, which is your chest and lungs. On camera, are you okay with this? Alright. For all intents and purposes, I've already sanitized my hands. She's already gowned appropriately. And every time that I touch my stethoscope to her skin, or to her, it's going to be to her bare skin. Every time I touch her, it's going to be on her bare skin. Just for this purpose, we're going to leave her clothed. Okay, Miss Lee, I'm going to go ahead and have you just sit here, relax, close your eyes, breathe in and out. Normally, I'm just going to watch you breathe, okay? In this instance, I'm going to watch her her facial expressions, make sure she's not pursed lip breathing, no nasal flaring, her coloration is good, trachea is midline, no retractions, no bulging in her neck. Make sure her nails are pink and not blue, no clubbing. Make sure that she's not using any accessory muscles to breathe. Make sure that she does not have a barrel chest to where her anterior posterior is not wide as her transverse dimensions of her chest. Then I'm going to go ahead and ask Miss Lee if it's okay if I get you to turn your back to the camera so I can continue my assessment. And as we continue inspecting here, we're going to notice her backbone is straight. She doesn't have any scoliosis of curvature left or right of her spine. She does not have any kyphosis forward curvature as well, which would affect lung expansion. Then we also going to go ahead and see if she's using any accessory muscles here. Her chest expansion is symmetrical. And now, Miss Lee, I'm going to go ahead and listen to you. All right. Now, every time I touch my stethoscope to you, I want you to breathe in and out. Okay. Now we have 20 areas to listen to on the back. So we're going to go along the scapula here and across, listening to each breath cycle. Make sure that there's not any wheezing or any adventitious breath sounds. They're going to be vesicular along here. They're going to be bronchovesicular here. So we will continue here, 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 here. And then, Miss Lee, I'm going to go ahead and touch you here with the balls of my hand. And I want you to say 99. I'm going to check fremitus for any air trapping or anything like this. Go ahead.
99.
Every time I touch you, I want you to say it.
99. 99. 99. 99. 99. 99. 99.
All right, now I'm going to go ahead and do the same thing with my stethoscope. This is a little exercise called bronchophony. When you say 99, it's supposed to sound muffled through my stethoscope. If I can hear a clear 99, that signifies some consolidation pneumonia.
99. 99.
And now you're going to go through the whole lung fields here. So you're going to go all the way down her back, listening and making sure. There's also egophony, where you do the same thing. You auscultate, as she says, E, and if you hear an A, that signifies some consolidation and some whispered pectoriloquy, I'm sorry. And that's just basically where she whispers 1, 2, 3 as you listen to her chest. And if you can hear the actual 1, 2, 3, then that signifies some consolidation as well. And now I'm just going to palpate here for any obvious masses or anything like this, tenderness. I'm going to make sure that her chest expansion is symmetrical. So what I'm going to do is put my thumbs in the middle part of her back, about an inch apart at the 10th rib, and get her to breathe in. Go ahead and breathe in, Miss Lee. They should spread about 2 to 3 inches apart, okay? And then I will move to percussion, and that's basically where I place my finger and tap along her lung fields here, and I should hear resonance along the lung fields, all along her lungs. And once I get over her liver, I should hear some dullness. And if I hear any hyperresonance, that's an indication of some air trapping, as in COPD or something like that. Okay, Miss Lee, we're going to go ahead and turn around and face the camera now. In the anterior position, we're going to do a lot of the same things that we did in the back. We do not have as many areas to check, so I'm going to go ahead and listen to your front here. Actually, first let me inspect her sternum, make sure it's midline. It's not deformed, it doesn't have pectus excavatum or carinatum. Excavatum is going in, carinatum is coming out, where it looks like a pigeon chest. Her ribs are at the proper angle. They're not flattened out as in a barrel chest as COPD or chronic obstructive airway disease. So I'm going to go ahead and just listen. Go ahead and breathe in and out for me. And while I go on each side of her sternal border here, it's a good idea to go ahead and just kind of listen to her heart, just to see if you hear any extra sounds, murmurs or anything like this. And you also want to keep an eye on your patient to make sure that they're not having any distress with the exercises that you have them do. Then I'm obviously going to do the fremitus on the front. If you say 99 for me,
99.
you're going to check for the same
99.
things that you
99.
check for on the back.
99.
Okay, and then after that, you're also going to percuss. You're going to hear some resonance over the lungs here. You're going to hear dullness over her bones and muscle. You're going to hear some tympany over her stomach, and some dullness over her liver as well. Now, Lee, do you have any problems breathing? Pain, any exacerbation, anything like that? You're also, when you're feeling here, you're going to feel for crepitus in her neck and all that stuff, just some little crackling and all that stuff as well, all on the back. Could be some air escaping from a bleb or a weak spot in her lung. If she had a trach, this would be a main area. And if she's active with the air, it would always travel up to dissipate out. And I believe that's going to conclude our assessment. Miss Lee, do you have any questions, comments, concerns, or criticisms?
No,
All right, thank you very much, and you have a good day.
thank you.
Go ahead and get dressed.